You know, you see it on TV, you have family members that have gone through it, but when it's your own first delivery, it's really a significant moment, I think. You're pretty anxious. You do a lot of, okay, what's the monitor say? That first time you hear that heartbeat and then it speeds up and is that okay? And then it slows back down. Well, is that okay? And then you call the nurse in. She's like, oh no, everything's fine. It's supposed to do that. So it's just kind of a lot of unknown.
Well, I will tell you that all of us, myself included, feel for the patient.
Patient comes in usually scared. I don't care if it's their first baby or their fourth baby, it's a new adventure.
The first thing I try to do as a nurse is to reassure them that they will get good care, that we're there to help them, and we'll make them as comfortable as possible. We are very aware of labor progress, the fetal heart rate tracing, and the well-being of the baby. We're kind of doing the background and watching everything and making sure that everything that we're seeing on the fetal monitor is reassuring.
And then the nurse's job would be then to contact the physician and report the findings, both of how the mother is doing, but also of how the fetus is doing. And that required an interpretation of the fetal heart rate tracing. And while there are standards for how to communicate the interpretation of that tracing, sometimes that communication can be lost.
The first time I actually used AirStrip OB, I looked at my phone and saw the actual strip that I normally see in the hospital was there on my phone. I just knew from that point on that it was going to be a great thing that I can check on my patients anytime, anywhere.
AirStrip technology delivers monitor tracings to a physician's mobile device.
It allows you to look at the fetal heart rate tracing and provide an accurate interpretation right then and there.
Another great thing about the AirStrip OB is it's not just the strip. I can look at my patient's vitals, her cervical dilation, the nurse's notes. There are times in the day where I'm in the clinic or at another hospital and I can't actually see that strip. Now that I have the ability to look at the strip, no matter where I'm at, no matter what I'm doing, I can see exactly what's going on with my patient and her baby.
It's not always easy to describe what a heart rate looks like or what a contraction pattern looks like. Every physician hears you differently. I like knowing that what I'm trying to explain to the physician, they can actually see on AirStrip OB.
Well, practicing maternal fetal medicine or high-risk obstetrics is important because there really are some very serious complications that you can have while being pregnant, and my role, again, in all of that is really to ensure the health and well-being of both the baby and the mother. So the first time I used AirStrip OB, it was quite an amazing experience to see that I could view the fetal heart rate tracing right at that instant, being able to have an idea of how my patient and her baby are doing.
The way I look at it is a birth can be uneventful until it's not.
Sometimes unexpectedly things can go wrong, and you want to be able to know that as soon as possible because that allows you to improve the outcome of the baby.
At that time, you need to be able to act quickly, and having AirStrip OB technology allows us to do that.
I think organizations have to really analyze what it can do for them in terms of managing risk, in terms of patient satisfaction, all the things that are important to keep your institution running.
It definitely is exciting to be a physician now because you can see how modern technology can really influence the practice of medicine and provide better care for all patients.
I think I have the best job in the world. I love being a part of the miracle that is childbirth and love working with the patients.